San Jose State continues to be the doorway to the heart of global innovation. What we learn together now will benefit our community when we welcome everyone back to campus. SJSU, Silicon Valley's public university.
Welcome, and I want to thank everyone for attending today's town hall on San Jose State's Adapt plan. This is the latest in a series of town halls we have held over the course of this pandemic to share information with and answer questions from our campus community. I'd like to start by reading the land acknowledgement. While we gather at San Jose State University, we are gathered on the ethno-historic tribal territory of the Papazian Ohlone, who were the direct ancestors of the lineages enrolled in the Muwekma Ohlone tribe, and who were missionized into missions Santa Clara, San Jose, and Dolores. The lands on which San Jose State University is established was and continues to be of significance to the Muwekma Ohlone tribe. We also recognize that the ancestors of the Muwekma Ohlone constructed and maintained the 3 Bay Area missions. Our campus extends to surrounding areas that held a tupantak, a traditional roundhouse, which were once located at the historic Lope Iniego land grant Rancho Posolmi y Pocitas de las Animas, Little Wells of Souls, and also Marcelo, Pio, and Cristobal's land grant Rancho Ulistat, which were places of celebration and religious ceremonies, as well as nearby ancestral heritage shell mounds that served as the tribe's traditional cemetery sites and territorial monuments. San Jose State University also desires to honor the military service of the Muwekma, who have honorably served overseas during World War I, World War II, Korea, Vietnam, Desert Storm, Iraq, and who are still serving in the United States Armed Forces today. Now, I'd like to begin by acknowledging the tremendous work over this past year and a half from our faculty and staff, as well as the resiliency of our students during a uniquely challenging period. In the next hour or so, we'll highlight key aspects of our plans moving forward into this fall semester, including recent adjustments made due to the Delta variant and latest county and CDC guidance. I'd like to say and stress that we are working on how we can best navigate together at this stage of the pandemic, and just remind everyone that kindness, patience, and continued flexibility will continue to be key. In short, we are still in the midst of a public health crisis, and I know we all are painfully aware of that. And we continue to encourage every member of our community who can to get vaccinated as soon as possible. The vaccination numbers we have been receiving as a university are promising. As of Friday, August 6th, nearly 60% of the student population has submitted their attestation, with more than 95% of the students attesting that they are vaccinated. More than 80% of our faculty and staff also have submitted their attestation, with about 97% of faculty and staff attesting they are vaccinated. This is really important and will help us in our efforts to keep our campus community safe. We remain vigilant and flexible with our policy guidance, and we will continue to adhere to safety precautions. Now, today we will highlight how San Jose State is responding to the CSU's vaccination requirement, how the university is working to keep you safe from the Delta variant, and the process for safely returning people and programs to campus. The majority of the time, however, will be dedicated to answering your questions. So I'd like to thank those who submitted questions in advance. I know some of you had more questions than you had room to put in, and I assure you that there are probably some of your questions being asked by others. But if not, please continue to share them through our Health Advisory's website, and we will do all we can to get answers to you. I want to emphasize too that the safety and the health of our students and the entire campus community has driven our SJSU Adapt plan from the beginning and will continue to do so. And finally, the recordings, and this is of course being recorded as have been the previous town halls, And the recordings will be posted and accessible on the SJSU Adapt website for those of you who want to review it again and for those who were not able to join us today. Now, before handing things over to Provost Vincent Del Casino, I'd like to just mention two brief housekeeping items. To submit a question for the Q&A session, please click on the Q&A button on your Zoom toolbar. And as I indicated, we are recording today's session, and this recording will be shared on the Health Advisories page on the San Jose State website. I'd like now to introduce our Provost, Vin Del Casino, who will kick things off with a discussion about the teaching and learning plans we expect to see this semester. Vin.
Thanks, President Papazian. So I wanted to highlight a few key points that'll frame the larger discussion for the rest of the day. Right now, we're getting a lot of questions about the fall course schedule and changes to modality. And what we're doing is we're keeping the fall course schedule the way it is. So everyone should know that their course is taught in a particular way and the students understand what's being offered and so forth. If faculty need to change the modality because of an accommodation, they should go through the various processes that are accounted for. I've got a larger message that'll go out tomorrow that'll highlight a number of these issues. We want to use, many people have already been asking about language for syllabi and so forth. And what we would like to do to take the pressure off faculty having to update things regularly is use Canvas and embed some stable messaging in the Canvas shell that shows up in all the classes and so forth. So we can have updates on the mask mandates and other types of language and so forth. So faculty are not having to do that individually. We're also developing a series of FAQs on the conduct and outbreak containment and other sorts of things so that, again, faculty don't feel like they have to be putting all this information in their syllabi and also creating their own protocols for all of this. People are, wondering why, it's taken so long to do some of these things. Well, as you know, it's a very dynamic environment right now. And what I'm saying today is as of today. We meet as a policy group regularly. I met with associate deans today. I get a lot of input from the deans and others. And so we're constantly having to adapt where we are. So the combination of the Canvas language and the FAQs on conduct and so forth, and we're taking a very strong stance, making sure that two of the key prongs of public safety, vaccination and masks, are really deeply embedded in our community. The other thing that we're going to be doing and we need to be paying attention to is an ongoing analysis of week by week updates so that we can continue academic and business as needed. And so what we mean by that is we may have to adapt as we have in the past, and we need to be prepared for that. So we're working on a series of strategies and conversations are being had right now about what that looks like and what that means. All of this is to say that we're trying to adjust quickly to the changing environment. We're trying to think about what this means in the context of the classroom and trying to provide as many resources as possible so that faculty have the answers of how to address questions such as conduct or what it means to wear masks or how we're moving around the campus and so forth. There is a lot more to come, and we'll touch on these in some more depth in a little bit. The final thing I'll say as well in all of this is we have got to continue to be sort of nimble and prepared to change. And while I was hoping that the fall would be much more kind of calm and stable, we know that we're still in a shifting world, and we have to be able to move accordingly to all of this. So with that, let me setting the stage for some of the larger conversations is to suggest that we're keeping the schedule and everything going the way it is, and we're going to work on making sure the messaging is very clear about how we continue to keep our community safe. With that, let me transition over to Dr. Barbara Fu, who's our acting medical director at the Student Wellness Center, and she can provide some updates on COVID-19 and our overall campus response.
Thank you, Vin. I'd like to welcome everyone to the new semester and present some of the compliance updates and new health and safety measures for this fall. In July, the CSU released the requirement for faculty, staff, and students who are accessing campus facilities to be immunized against the SARS-CoV-2 virus. San Jose State is recommending that vaccination information be completed as soon as possible to be ready for the fall semester. And the policy requires that all certifications be completed no later than September 30th, 2021. The current policy will allow for medical and religious exemptions. Let's go to the first slide. So students can start the process by first completing the COVID-19 vaccine self-certification form, which can be found on the SJSU Health Advisories page. And let's go to the next slide. For students who are vaccinated or are requesting a medical exemption, after finishing the vaccine self-certification form, they'll need to next go to the Student Health Center patient portal to upload their vaccine or medical exemption documents. And these documents will be reviewed by the verification team. For persons who have approved exemptions and are not vaccinated, there will be additional safety measures required to access campus facilities, and they will include wearing masks, physically distancing, and participating in the university COVID-19 testing protocols. The university COVID-19 entry testing events will begin on August the 23rd and will take place on Mondays through Wednesdays for 2 weeks. And afterwards, there will be follow-up surveillance testing done on a weekly basis. Students who are unvaccinated and notified of the COVID testing events will receive appointment sign-up information around 2 weeks before the beginning of the entry testing events. Testing is planned to take place at the event center, and masks will be required at the testing site. In August, our county, along with other Bay Area county health departments, began requiring masks in public indoor spaces for both vaccinated and unvaccinated persons because of the increasing cases of COVID-19 due to the Delta variant. If a campus member notices that they have symptoms of COVID-19, they should not come to campus and they should get tested. The university has a helpful COVID-19 symptom check tool that can be found at the SJSU Health Advisories page under the Resources tab. To find COVID-19 testing sites, you can go to the website sccfreetest.org, check local pharmacies and healthcare providers, or students can call the Student Wellness Center and employees can contact university personnel. If you are a close contact, have symptoms of COVID-19, or have a positive COVID-19 test, notify the university by using the Report a Case form located at the Health Advisories website. After the report is received, the case management team will perform the necessary investigations to determine university exposures, notifications, and requirements for campus cleaning. For those who are unvaccinated, there are many ways to get the COVID-19 vaccine. To find locations near you, you can go to myturn.ca.gov, or you can get the COVID-19 vaccine from all major pharmacies and healthcare providers. In addition, San Jose State and the county are having their next vaccine pop-up clinic on August the 25th at the Student Wellness Center, where the Pfizer and the Johnson & Johnson vaccine will be available. In the US, a person is considered fully vaccinated if it has been at least 2 weeks from their completion of a US FDA EUA vaccine or a WHO EUL vaccine. And now I'd like to introduce Lisa Malora, Vice President for Strategy and Chief of Staff, who will use the remaining time to moderate questions and answers.
Thank you, Dr. Fu. The remainder of this meeting will be dedicated to questions and answers. And as a reminder, you are welcome to ask questions through the Q&A button on your toolbar. Over 1,000 members of our community registered for this town hall and many submitted questions. So we will do our best to answer all questions during the session and post the answers on our Health Advisories website. After the town hall, you can submit additional questions through Health Advisories at sjsu.edu. So with that, I'm just remind my colleagues to try to be as concise as possible so we can get to as many questions as possible. First, I'd like to invite Joanne Wright to join me. We've had several questions submitted about the workplace. Joanne is our Senior Associate Vice President for University Personnel, and in her role, she oversees what many of us think of as human resources, employee support programs, and employee relations. Hi, Joanne. First question for you. Is SJSU allowing staff to work from home all 5 days due to the new masks mandate, since many people find it difficult to wear masks for a 9-hour period?
So I do want to gently remind that this really is not a new mask mandate. It has been in place for a bit. It was briefly lifted, if you recall, in the middle of July, and then we pivoted right on back because of things that were going on, and Santa Clara County, required that. So it's really not new. We've had essential personnel on campus for probably this entire time who have been, wearing the masks. I have people on my own staff who've been working inside in offices and, have followed the mask mandate and, wear their mask as required. But so just wanted to remind people too, our repopulation goals, rebuilding the campus community, and based on the business and operation needs to support this increased student population that's coming back. That is why, we have the repopulation happening now. I do want to encourage people who, for this person who's asking about wearing the mask for a long period of time, reminding that there are breaks that should be taken, definitely encouraging those. So take a break in the morning, take a break in the afternoon, meal breaks, take those opportunities to get outside, walk, remove the mask, or find a place to eat. So definitely take advantage of those opportunities.
Great, thank you. With respect to hybrid schedules, is there flexibility in the hybrid schedule if we must change our schedule each week?
So this might be a particular situation that's being asked about, so I'm not sure exactly what the situation is, but if for whatever reason there might be an opportunity or maybe a necessity to change scheduled days, that is a possibility. So yes.
Okay. Now, will a shared space and hybrid work environment be part of San Jose State's future?
Well, there's a lot being discussed right now. So I would say that we're discussing all possibilities. So that could be a possibility for the future. Yes.
Could you say a little bit about the likelihood or the possibility of going back to fully remote work?
So fully remote for everybody, it's always based on business needs, right? And again, our mission is to educate our students, to enrich our students' lives. So that is our mission. So that is, what our business needs and operational needs are based on. So as we see an increased student population and as we turn the corner in COVID, I don't know that we would go back to all remote, everybody remote all the time. There may be, or telecommuting, there may be opportunities for people to telecommute, have hybrid schedules. And again, those types of things are being discussed, definitely on the table. We see that there are possibilities there. And so we are definitely discussing those.
Okay, great, thank you. I'm going to invite Dr. Fu back to join us for another set of questions about testing and vaccinations. So Joanne, you could start us off. A question that I know is important to many of our community members is what our current vaccination rates are for employees. And the president spoke to this a little bit, but it might be helpful to remind all of our participants today what the vaccination rates look like.
They look really strong. So for faculty, I'll just split up into faculty and staff, right? So with faculty, there are 83% that have reported, and of that 83%, 98% reported fully vaccinated. For staff, 82% reported, and 95.5% said fully vaccinated of that group.
Wonderful. Dr. Fu, do you know the vaccination rates as of today for our students?
Yes, as of this morning, August 9th, as President Papazian mentioned, there are nearly 60% of students who have submitted their certification, and over 94% of those students have attested to being vaccinated.
Wonderful. This question is for Dr. Fu again. Could you share what the CSU vaccination requirement entails for students, and what is the associated deadline?
Yeah, certainly. So students need to certify and submit their information that they have full COVID-19 vaccination or that they have requested an exemption by September 30th, 2021. And with the fall semester right around the corner and classes beginning soon, we recommend that students submit their information as soon as possible. Since it takes 2 weeks for a person to be fully vaccinated, in order to be fully vaccinated by September 30th, the last completing dose of a vaccine should be received by September 16th. 2021. And I also wanted to include that students know that there is a student and parent town hall planned for August 12th if they have more questions about this.
Great, thank you. And we'll make sure to provide whatever information we have in a link in the chat for everyone. Dr. Fu, I know that there has been quite a bit of confusion about the interim policy versus a permanent policy. So I'll read the question this way. Many of us understood that we had the option to wait for full FDA approval, but now the vaccine is required even without the approval. What has changed?
Yes, well, as we're seeing new variants of the SARS-CoV-2 virus, such as the Delta variant that can spread more easily and is believed to cause more severe disease, and with the increasing number of cases around us, this has really required us to change some of our strategies to help keep our community safer.
Great, thank you. Let's talk about the same sort of requirements for faculty and staff. Joanne, can you share the CSU vaccination requirements for staff and faculty?
Right, so the policy states that we are requiring everyone to be fully vaccinated by September 30th. For employees, there's basically kind of two groups we have to talk about too, that because we have to respect the fact that we have a large group of represented employees, that includes faculty, and there are meet and confers going on at the Chancellor's office, so system-wide, with our union partners concerning just all the implications of the interim policy. So as we await that, just wanted to say that we expect that, or we would like to see that we would have vaccination verification, meaning documentation submitted to show fully vaccinated status. And so that's what we would like to do. But meanwhile, we have to wait until these discussions with our union partners are finished to have that finalized.
I know that there are lots of questions also about how the policy, whether the policy applies to vendors, consultants, and contractors. Can you speak to that?
Yes, it does actually apply, because again, it applies to everyone accessing the campus facilities. Now, for contractors and vendors, there would typically be the safety measures that we have in place that they would be expected to follow. So that would be the masking. We'd expect that people are vaccinated actually too, but the masking, because we wouldn't be testing them or having vaccination cards submitted by them, unless we decided that was something we needed to do for contractors who are long-term on campus, and then we can also request that. But all safety measures, we would be expecting that contractors and vendors follow those.
Great, thank you. Now, Joanne, this question is for you too. If I'm an employee and I do not want to get the vaccine, can I work remotely full-time?
So the determination of whether somebody is working or telecommuting or has a hybrid schedule or on campus 5 days a week is based on business and operation needs and the support of our mission, again, which is to support our students' education. So it's not the fact that if you're vaccinated or not vaccinated, that's going to determine telecommuting status. So if you don't choose to get the vaccine, then there may be religious or medical exemptions, and I understand that. So, we would be having the testing protocol for individuals who might be in that group. Or there may be consequences if someone is deciding not to get vaccinated at all, based on the requirement that we have that's coming up.
Great, thank you. Now, for both of you, we'll start with Joanne. How can I verify that SJSU has received my vaccination proof record?
So we have started collecting the vaccination documentation for employees, auxiliaries, volunteers, and our CSUEU and our SUPA employees, the CSUEU and SUPA employees for the testing protocol. We already have MOUs with those unions, and so we're moving forward with those groups. They are currently submitting their proof of vaccination documentation into PeopleSoft. So if you have any questions about whether those documents went through, I've received questions from people who say they may have had a glitch or something they're asking about. Just email us. There was an email address that was provided in the messaging that was sent to you on Thursday. We'll be sending that out again. So just ask us and we'll let you know and verify that we've received your information.
Great, thanks. Joanne, if you'd like to take a break for a moment, I can call you back when we have another set of questions. Dr. Fu, same question for you. How can I, as a student, verify that SJSU has received my vaccination record?
Right. Yeah, for students, it can take 2 to 10 business days for their records to be processed. So after student records have been verified, if they go to the Student Health Center patient portal in the medical clearances section, they can see that their status will have been changed to compliant.
Very good, thank you. Now, here are some nuts and bolts questions that I think are very important to our students who are trying to work with the deadline. I'm a student and my second vaccination dose is scheduled for August 16th. Can I attend my registered classes on campus that week?
Right. So for a person to be considered fully vaccinated, there needs to be 2 weeks after finishing the last dose of an approved vaccine. So if a student is not fully vaccinated, to access the campus facilities, they'll need to participate in the additional safety measures and the COVID-19 testing protocols until they're fully vaccinated.
Okay. Now, for students who are taking all online classes, do those students need to also comply with the vaccination requirement?
Yeah, the university expects that all SJA students will comply with the COVID-19 vaccine policy and complete the CSU self-certification form. If a student is all online and will not access the campus facilities, then they can mark that option on the self-certification form.
Okay, now here's a question for both you and Joanne. So I'm going to ask Joanne to join us as you finish up. Dr. Fu, will there be a system to visibly identify vaccinated people? Is there a way for the university to verify that people are actually vaccinated?
Yeah, there's nothing that visibly identifies a vaccinated person. Vaccine information, though, is being collected and stored securely, and student records that are submitted are being reviewed by the verification team. So we do have a system that can document those who've had their COVID-19 vaccines verified.
And that I would reiterate what Dr. Fu said. Yeah, there will be nobody's going to be identified as vaccinated or not vaccinated on campus, but we do have a system where we have a team that's looking at the documentation that's being submitted, and people are submitting their documentation showing that they're fully vaccinated.
Great. And Joanne, I might go a step farther just to say, I think that, part of what is behind this question when asked by others is a concern for privacy. And so I wonder if you could just say a little bit about or speak to that concern.
Yes, and similarly to what Dr. Fu stated, these records are maintained securely. They would not be shared out. So we're very concerned with privacy, obviously, and would not, again, share those. And we maintain those on a secure database, all those records with limited access.
Very good, thank you. Now let me go to a set of questions about testing, and these are all for Dr. Fu. Dr. Fu, will our health center be offering testing? And if so, will testing be available to staff and faculty?
Right, so as mentioned earlier, there will be the entry and surveillance COVID-19 testing events for unvaccinated students or employees that'll happen at the event center. Now, if someone has symptoms of COVID-19 or is a close contact and needs COVID-19 testing, they should call their healthcare provider, or students can call the Student Wellness Center and employees can contact university personnel.
Great. This has come up a few times, the idea of weekly testing. Can you say a little bit about what weekly testing is and how it will be conducted?
Right. So at this time, as of today, August the 9th, the weekly testing will involve selecting a randomized sample of the unvaccinated members of the university to participate in the testing. So they'll receive the message that of the dates that they need to go in and how to sign up for the free COVID-19 testing.
Thank you. And I think that you may have spoken to this before, but how do exemptions work with the weekly testing program?
Right. So if someone has a medical or religious exemption and are therefore not vaccinated, they will be part of the testing protocol and will need to participate in these tests.
Very good. Thank you. Now, you started to say a little bit about contact tracing and that sort of thing. What should someone do if a student in an in-person class tested positive for COVID-19?
Right. So a student should immediately isolate themselves if they test positive, and they should submit a report of case form to the university so that the case management team can again perform the necessary tracing, investigation, and notifications of exposures or any university close contacts, as well as work with FD&O for any campus building cleanings. The university will follow all county and Cal OSHA regulations in positive COVID-19 cases that occur on campus.
Very good, thank you. And one final question, which is not about testing, but sort of loops back to the vaccine policy. This is for international students. This is about international students. For international students who have already taken double dose country-approved vaccines from their home country, do they need to again take Pfizer or Johnson & Johnson vaccines by September 30th?
Yes, in order to be considered fully vaccinated in the US, it has to be either a US FDA, EUA vaccine, or a WHO EUL vaccine. So they would need to participate in the additional safety precautions until they're fully vaccinated.
Okay, thanks. I'm going to invite Joanne to join us for another pair of questions. And they're both about not complying with the policy. So we'll start with you, Dr. Fu. What are the consequences for not getting vaccinated by the deadline?
If someone is not vaccinated by the deadlines, then they will again have to participate in the safety measures as well as be part of the COVID-19 testing protocols.
Thank you. And Joanne, can you answer the same question for employees?
Yes. So I'll answer for, again, there's kind of two groups at this point because we are awaiting the meet and confer those to finish with our unions. And so the discussions there are about compliance, non-compliance with the vaccination policy. So we will wait for those MOUs or those meet and confers to complete before we're able to really answer that. But there will be formal consequences. So for our represented employees, there would be formal consequences if there's no exemption and there's no vaccination. And that would, the deadline is September 30th. So as of October 1st, there would be consequences, to be had. Their volunteers who don't comply would be dismissed from whatever task they are assigned to do. So again, we are waiting for the union meet and confers for the represented employees to be able to answer that fully.
Okay, and this might have gotten lost, but who will enforce the vaccination requirements for employees?
So as we are collecting data, on vaccination status, we would know, right, which individuals are not reporting fully vaccinated. So we'd be able to understand, what our population is in that group, the non-compliance group. So we would be then looking at that and enforcing the whatever the compliance would be at that time. And then did you ask about mask mandates? I'm sorry.
Yes.
You did. Okay, sorry. I wasn't sure if I heard that or not. So for masks too, we would also be participating with managers, understanding who is not following the mask mandate of being masked indoors. And so the UP team, the employee relations team, would be in consultation with MPPs, managers on the ground who are reporting that people are not complying for formal consequences.
Thank you. As I've announced to everyone in the chat, I would like to invite Patrick Day, our Vice President for Student Affairs, to join us. I think it's important for us to share with our university community that as the environmental contexts change for us, including the recent surge in cases due to the Delta variant, our guidelines continue to change as well. And we recognize that can be frustrating and confusing and even fatiguing. And what we are really aiming to do is to ensure that we are creating an environment in which the health and safety of our university community comes first. So with that, Patrick, I know that Dr. Fu spoke to this question of not getting vaccinated by the deadline in terms of how we go about including those students in a testing protocol. Can you say what I speak to a question that I think is on others' minds, which is how do we push people more in that direction? So what will happen if a student does not meet the vaccine deadline and or does not follow the mask mandate?
Right. No, I appreciate that question. And I think that is what's on people's mind. Let me start off by saying that we are not interested in students not being able to come to school, fully participate because of issues of noncompliance. That's not the goal here. The goal for us is to have a safe community. So I want to start there. But I do want to say we are going to have to put a period on it. And so let me give a couple of examples. So one of the things, if students are not responding, if they're simply not responding to what they've been asked to do, then we will begin to move into a space on October 1st where their classes will be dropped and they will not be able to access facilities. If we find ourselves where students aren't participating in the testing protocol, they will receive a warning letter. And at some point, if they still continue to be non-compliant, we would also move to dropping classes and not allowing access to facilities. And certainly if we have situations that are what I would suggest far more serious, where we have information that's been misrepresented, not only would we be talking about students being removed from classes, we would also be talking about students moving into the conduct process. Now, I want to be clear on something. These aren't just going to happen with no notice. There's going to be continual communication with students, reminding them to please provide their information, to please participate in testing. So this is not something that happens, or there's one message and then suddenly you lose all of your classes. Quite the contrary, that's not the goal here. However, what we know is in order to have a safe campus, we're all going to have to be responsible and participate in these kinds of safety measures. And as we can see already with our students, and as we saw last year, the majority of students are already complying and want to have a safe campus. And so we need to have these kinds of guardrails so that we can ensure that we do have a safe year.
Very good. Patrick, a couple of follow-ups. I know that Dr. Fu mentioned that there is a town hall coming up August 12th, I believe. And so students can continue to sign up for that to ask these sorts of questions, right?
Absolutely.
Where can students find this information in the coming days and weeks as we develop more clear and user-friendly information that students can reference from time to time? Where should they look? Right.
So certainly the Health Advisory's website is going to be one of the places that will always have information. You saw we began to speak about it in the president's message that came out today. We will continue to have students will receive individual messages instructing them individually of what they need to do with regard to their specific status. And there will be other messages that will likely come out from our Student Wellness Center, as well, and also from our housing area, and some messages that will likely come out from me as well. So there's going to be lots of information that's out there. And if people have a question, we're going to encourage people to respond to the messages, to send something to the Health Advisory's website. We're not sending it into the abyss. That information is coming to departments so that we can get students the answers that they need. Because again, our goal here is to help students be able to be successful and have a safe and healthy year.
Great, thank you. Can we assure the students who are here and who might join the town hall that some of the questions that I'm seeing show up in the chat that have to do with housing policies and some other very student-specific sort of spaces and questions, if we don't get to them here, we can bring them over to that town hall and make sure we get them answered there?
No question. In fact, we'll try and front load some of those so that maybe we can preempt, because it's hard, certainly, as we have so many questions coming in, because our goal is to get those questions answered. And we may be able to do some of that between now and that second town hall, because we do want students to have those answers.
Great, thank you. Patrick, I think those are all the questions I have for you right now. I'm going to ask two other campus leaders to join us on the next set of questions. Our provost, whom we've all met, Vincent Del Casino, and Tracy Fertilage, our Senior Associate Vice President for Facilities Development and Operations. And for those of you who haven't yet met Tracy, Tracy is the person who spearheaded several of the physical changes to the campus during the pandemic to keep us safe during this time. So first question for you, Tracy, can you clarify what the mask policy is? We've referenced it a few times, but we haven't stated very clearly what it is.
Yeah, and even if we have stated it clearly, it's worth re-mentioning that, because there have just been so many darn changes So face covering policy as it currently applies, all persons regardless of their vaccination status must wear a face covering while indoors, unless they're in a fully enclosed private office with the doors closed. Everyone must also wear a mask if they're in a shared vehicle on university business. And this includes campus shuttles or other forms of university-sponsored shared transportation that we have. If a person is unvaccinated at this time, they need to wear a mask outdoors if they're unable to maintain 6 feet of physical distancing from others. I would also remind everybody there are a few exceptions to the face covering requirements. As I said earlier, if you're alone in a fully enclosed office with the door closed, you can take your mask off. But in addition to that, when you're performing some type of activity in which wearing the mask would be unsafe, a great example is swimming in our natatorium in the pool over at SPX. That just kind of wouldn't be an easy thing to accomplish with a mask on. We also sometimes have people who work in a condition where it would be unsafe to wear that mask. Like if say one of our facilities folks are working in front of an electrical panel and such. But there are some exemptions to the face covering requirement too, as listed by the California Department of Public Health. And hopefully somebody can just put that link right inside the chat there, Lisa.
Great. Thanks, Tracy. You might want to take a break. I'm going to have a couple questions for Vin, and then I'm actually going to ask Joanne Wright to join us again to fill in a couple of blanks. So with respect to oh my goodness, it's just gone right out of my screen. Joanne, there was a question that came in that still relates to vaccines, and it's this. The California State Board of Education required public K-12 to open up more spaces in district virtual academies to keep children and the immune compromised safe. As the parent of a child too young to be vaccinated, who has chosen to send their child to school virtually, why am I being forced to return to in-person instruction?
So I don't know what department or what college this particular faculty member is in, but I can state that again, our mission is to educate our students, enrich their lives, and I'm going to assume that there was a need, and this was a decision that was made within the college to have certain classes in person, certain classes hybrid, to meet the needs of the department and the students. So having said that, if there are issues that this individual may have with childcare or some other COVID-related issues, please speak to our leaves manager, and that can be put into the chat too, the contact information there for that individual to discuss any types of options you might have and concerns about, working around your in-person schedule.
Great, thank you. And then another question for you before we get to masks in classes, which I know many people would like to hear about. Joanne, one more question for you. Will the changing mask mandates and the increased risk of the new variant warrant a revision of different departments' repopulation plans?
So as of today, we are in our transition phase, repopulating campus for fall semester. I have to say that as a group and as a campus, the policy group, the cabinet, the president, we are discussing on weekly basis. We're meeting at least once a week, if not twice a week, or if not more in smaller groups to discuss all kinds of safety and health measures and where we are with what we know, with what is going on with the new variant and with COVID-19 in general. So as we learn what's happening as we move forward, we will always keep the safety and health of our campus constituents at the forefront and make decisions that need to be made to protect our campus constituents. So as of today, we are where we are. We have a repopulation plan moving forward. The mask mandate is in place. We're continuing to implement safety and health measures such as testing protocols and again, really strongly encouraging vaccination if you have not already been vaccinated, because we do want to protect ourselves and each other.
Very good, thank you. Thanks, Joanne. Vin, I have a number of questions for you, starting that are relevant to masks, but starting with masks in classes. What are the rules for social distancing and masking in class?
Well, the rules as they are today is when we start classes on the 19th, everyone will be wearing masks indoors. So a class that is outdoors conceptually could have a different approach, but majority of our classes are indoors. So students must wear, everyone must wear a mask in the classroom. Now, we do not currently have any physical distancing requirements, and those have not been recommended by the county. So we do not currently have physical distancing. Between the vaccination policy and the mask, we hope to cover the majority of the issues related to safety.
Great. Can you advise faculty how to address situations when students in their classes do not want to wear masks?
Yeah, it's a great question. And I hope we don't have the reverse, where students are concerned about faculty or staff. But in the context of students, we're developing a protocol out of student affairs of the steps that everybody should take, how to get in contact with somebody if you're having concerns in your classroom, and we will react quickly to that. What we found last year is people really adhered to the mask policy. I think given everything right now, we have a lot of confidence that we will. It doesn't mean we might not have one or two aberrations from that, but hopefully everybody will focus on it.
Thank you. I think there might be one finer point to make on this, and it's this question. Do faculty have the right to remove a non-compliant student from the classroom?
So we're providing, again, the protocols for how to do that. One of the options will be to ask a student to leave a classroom, if they're not complying, and we will back them. It may be that the next step will be a connection with somebody else to help support that. But yes, the faculty will be able to ask a student to leave if they're non-compliant with the mask policy.
Great, thank you. Here's a variation on this. If the indoor masking requirement is lifted during the semester, can faculty still require masks in labs?
I think this is an excellent question. I think we have to evaluate all the data, because the county may lift the mask protocol, but we as a campus may decide to maintain it through the semester to be consistent. One of the challenges is consistency across places. But I think given the fact that labs meet for longer periods of time, we should have some of those protocols in place. And I know that prior to the full mask requirement, research and innovation was already putting forward proposals to do those sorts of things.
Very good, thank you. Then you might want to take a break. I have 4 questions for Tracy, all in a row. Tracy, could you come back and join me? I'm going to start with the cubicles and that sort of shared space. Will masks be required for the entire duration of the workday for all individuals who work in cubicles and in shared spaces?
The short answer is yes, masks will be required. And it applies to those shared spaces and cubicles. If you're in a fully enclosed office, walls full height, door closed, then you can take your mask off. And I encourage folks to, use their breaks and other times when the weather's nice to get outside and take a break so you can be distanced from others and take your mask off.
Great, thank you. Now, this question had come in for Ben as well, but I'm going to pose it to you just so that we have a chance to reinforce the message. Are we supposed to do physical distancing indoors or only wear a mask? And are vaccinated individuals permitted to eat at Cubes by Me?
Sure. The mandates that come from the California Department of Public Health and from the county no longer have a physical distancing requirement indoors or maximum capacity requirements. We do have the face covering requirement indoors, and we'll look to folks to do that, but you no longer have to physically distance indoors. The unvaccinated persons still have to be physically distanced outdoors, or they have to wear a face covering. Now, if an individual is, say, in their cube and wanting to take a drink of water or have a snack at their desk, the face covering requirements do allow for you to take off your face covering while actively, and the key word being actively, eating or drinking. But I also encourage people to get up, go for a walk, try to find a place indoors where you can be in, say, a conference room to shut the door for a break or for your meal period, or more importantly, go outside and enjoy the nice weather while we have it.
So I think you're sort of you're leading into this next question here. So you'll repeat yourself a little bit.
Yeah.
But where do you recommend that students and faculty gather in the 30 minutes before classes? And then related to that, who will enforce the requirement that people stay out of the classrooms for the 30 minutes between classes?
Yeah, so, 30 minutes seems like a long time, but it often isn't by the time that we gather our things and actually get out the door. We do encourage people to leave the space, leave the building, and to not congregate in a way that would allow us to just be crowded in a hallway and jammed up. Having said all that, everybody should be wearing a face covering while they're indoors. That is the requirement. We're certainly asking everybody to step up as Spartans and take care of one another and abide by those requirements, because it's our responsibility as individuals to try to help keep our campus community safe. Know that we have certainly gone through the steps to enhance the filtration of our HVAC system, filtration and air changes per hour in all of our campus spaces. So we're in a place where we're providing as safe an environment as possible for the campus.
Great, thank you. Tracy, what can you say about the idea that's out there that the Delta variant can penetrate cloth masks? And if that is in fact accurate, will the university supply N95 disposable masks?
Yeah, so thanks for that question, Lisa. There's been a lot that's come back up, about masks and their effectiveness with the Delta variant. And as we, if we hearken ourselves all the way back to the beginning of the pandemic, we'll remember that there was a lot going on about which mask is most effective and what's happening. So certainly, your double layered cloth mask is still effective. The CDC certainly also recommends that if you use a disposable cloth mask or a disposable mask in front of that cloth mask, you get even more levels of effectiveness. Remember, the reason that we're putting the mask back on is about protecting ourselves and our fellow Spartans, right? And the Delta variant is much more transmissible than previous variants. And thus we want to try to capture that particulate and those respiratory droplets so that they aren't floating around out in the environment. The best way for us to do that is to don a mask. We don't need to don an N95. I still would advise that, one can certainly wear one. Will the campus be providing one? No, because we're still very sensitive to the fact that the Delta variant and the impact that it's having on our unpopulated or our unvaccinated population is resulting in our hospitals becoming much more busy. And it's very important to ensure that that supply of masks at that grade be available for our healthcare workers.
Very good, thank you. I think you made an important point that that can be easily forgotten, and it's that the mask should really cover your nose, mouth, and chin. And so I know it's warm right now and it's very tempting to let the mask slide down, but I think you're reminding us that we're trying to make sure that we're not leaving anything to chance.
Absolutely, wear a mask that has a nice nose bridge on it, because that helps pull down the mask to keep droplets from releasing themselves. Have it be snug to your face and fit well. Know that FDNO is placing stations near the main entrances to all building that has a surgical mask. So if you forget your mask, you can always grab one of those. We're going to be running around like crazy keeping that stocked, but there's a number on there. If it's empty, please let us know. We'll get some out right away. The other thing, and maybe we can also drop this in the chat, is that there's a way to order your own personal supply. We ordered some 2-ply cloth face coverings that not only celebrate being a Spartan, but our status as the #1 most transformational university in the United States. And so we're happy to send you a pack of 5 of those.
Great, thank you so much. I have one more question before you go. Is the August 25th pop-up clinic only for second doses?
This is a great question. So we have had a wonderful partnership with the county to offer these clinics. We're currently in discussions with them about the possibility of scheduling some additional clinics. We don't have dates yet, nor any promise that there's availability. But anybody who shows up for the August 25th clinic will have Pfizer as well as J&J vaccine available. For people who are showing up for their first time, we'll certainly more than likely get the J&J vaccine versus being, unless we have another date set up for a future clinic.
Great. Thank you so much, Tracy.
You're welcome.
Vin, I'm going to ask Vin to join me again. We have just about 15 minutes, and so we might need to pick up the pace a little bit as more questions have come in through the Q&A. So to get us started, Vin, I'll pair these questions. Will any class formats be changed in response to the spread of the Delta variant? And what would have to occur for the university to decide to move to in-person classes online similar to last spring?
Yeah, thanks for that. Right now, we're not changing any of the class schedules or anything like that based on what's going on. Secondarily, we are, as Joanne mentioned, meeting at least twice a week to discuss things. We're looking at numbers, and if we have a really big outbreak, that could very much demand a change campus-wide.
Okay. Now, what sort of choices are available for students and faculty? So here's the first question. Given the new mask mandate and rising cases of Delta, will students or faculty be able to choose to do classes remotely this fall?
Well, students have the option to find remote classes if they're there. Faculty are teaching the courses as they're assigned in the schedule of classes. So we're not necessarily just flipping classes wholesale based on that. If a faculty member needs an accommodation, then we would.
Okay, so similar to that sort of last point, this is for students. If students are experiencing COVID symptoms, will they be able to access what would normally be an in-person class through Zoom or another video?
Yeah, this is a great question. And each class has its own makeup policy and how to access information when one is sick. We're using similar protocols as we do now. We are not necessarily setting up and asking faculty members to record every single lecture or class, nor will they automatically have access to Zoom. So it's going to be the same sorts of approaches. Again, there are mechanisms on the campus for students who might have an extended leave based on an illness that would demand a different approach.
Okay. Now, I think you've spoken to this, but I want to ask it specifically the way it came in. Are faculty who are teaching face-to-face sections permitted to incorporate remote learning? And if a faculty member has COVID-like symptoms, can they teach online synchronously?
So there are two different questions. The first is the course, again, is as it is in the course schedule. So, in a normal semester, when you're teaching face-to-face, the expectation is that you're in that classroom. If a faculty member has COVID-like symptoms, the most important thing is that faculty member get well. So I'm nervous about saying, hey, go teach while you're ill. When someone gets sick at work, we have mechanisms for supporting them in that class. So, is there an instance where a faculty member might suspect and they might be in contact tracing and someone might say, stay off campus? Could we flip to remote briefly? There's always that possibility, but the standard of the class is where we need to be. So if it's face-to-face, it will be taught face-to-face.
Great, thank you. And also for faculty who are still prepping for their classes that will begin very soon, can they go to their classrooms now so they know what equipment they may need for their classes?
Yes.
Terrific. There are a couple of questions that are specific to students, and I'll recommend we move them to the student town hall with one exception. Will international students in the US need to take at least one face-to-face class this fall?
Yes, I believe that is the requirement currently, but we should verify that. And please come back to the town hall and we will message international students directly if I misspoke.
Very good. Thank you so much. And as a reminder, as the provost mentioned earlier, he's developing some messaging. We'll have some FAQs that are very specific to classes this fall and other academic issues. And be on the lookout for that. We'll be sure to communicate as much as we can with as much information as we can. Thank you, Ben. Let me bring Tracy back to answer a few questions about buildings and events. And we'll move through these quickly as well. Hey, Tracy.
Hi.
First question, what is the building access policy? And then second, will volunteers have access to campus buildings?
So we're continuing to transition to being a more secure campus, which means that our front doors will remain locked. Your tower card will enable you to get into the front door. We're still working through getting tower cards out to everybody. And because the start of any semester is a transitional period, we'll have a period of time where access is allowed just by going through the front door. But we will close that down and your tower card will get you in. If you're a student, you will have access to the range of buildings that we are teaching classes in, as well as some other campus spaces. And we'll be updating the website to tell you the hours that your tower card works. Faculty and staff will have access. Your tower card will work for you 24 hours a day, 7 days a week, 365 days a year. Now, having said that, we also have some specialized spaces and/or we have students that often will work on projects late at night. We'll go through the same process that we've always had with campus departments on requesting keys or card access to those spaces so that we can enable you to have access to someplace that the general access won't get you to.
Very good. Now, volunteers, do they have access to buildings? And if so, how do they get access?
So volunteers are treated, it's kind of a funny term I've only ever heard used here at San Jose State, but it's a person of interest. And so volunteers get registered through a process that declares them as a person of interest, and they're eligible to obtain a tower card or a building access card. And we go through that process of just requesting it.
Very good. Question, very specific. Will the student union be reopening?
Guess what? It's open. So it opened last Monday, and they have some limited hours right now, but I know that that will be expanding as we go forward, and more of the programs or offices that we previously had available prior to the pandemic will soon become available for the campus community.
Very good. Now, you've talked a lot about how you're encouraging folks to go outside when they can. We have nice weather here. Are there plans to create more outdoor seating than what we already have?
We're taking a look at that. We haven't ordered a bunch of picnic tables and benches to put on every lawn everywhere, but we are moving some things around to make them more accessible. And in spaces we recognize it's been hot lately, right? So we don't want people aren't going to necessarily sit right out in the baking sun in the middle of the day. So we're going to be looking at that very early on at the beginning of the semester to see what the patterns look like and to see places where we need to strategically add some of these furnishings if it's necessary. And if so, we will be looking at adding.
Great, thank you. One last set of questions, and then you may need to direct us to some resources online. There are lots of questions coming in about events and gatherings. What are the general guidelines for events and gatherings? How do masks fit in, and food?
So the easy thing is that the face covering requirement is, as I previously answered, if it's indoors, you're going to be required to wear a face covering. We're going to be looking at those event requests as they come in. And I think there are always going to be things that are exceptions to the rule, so to speak. Our focus right now is on trying to accommodate the needs of the campus community to restore campus life in a manner that's safe, right? So before we start booking all sorts of things, we're really looking to make sure that we support our students, faculty, and staff in their needs for different meetings and events on campus. And then as those requests come in, we're also taking a look at safety and safety requirements. Right now, there's not a lot of guidance from the state. A lot of the guidelines have been removed, right? And so what we're left with are some real guidelines about mega events. And frankly, we just don't have a lot of those. Those are events that are indoors over 5,000 people. We don't have a lot of spaces that can accommodate that, and outdoors over 10,000 people. Having said all that, I do know that the state is looking at its events guidance, so do expect things to move and shift over time. But right now, I would just advise groups to get the requests in, go through your normal processes that you've gone to request spaces, and we will work with you to help move your requests through in a manner that guarantees a safe event. And that includes food. One thing that I can tell you, we've talked about quite a bit in policy group, is just assume that buffets are out because of all of the touching that happens and being in more of a packaged environment when it comes to food.
Okay, great, thank you. So as we get more details around guidelines, we'll be sure to post them. Tracy, can I assume that we'll link out from the health advisory website to help folks have the right guidance around events and gatherings in the coming weeks?
Absolutely. That is absolutely where we need to link everything. That way everybody knows there's one place to go to find the information, even if you have to dig a little tiny bit to find it.
Perfect. Thank you so much. Thanks, Tracy. I'm now going to invite Patrick Day back. Patrick is our Vice President for Student Affairs. And I think we have just enough time to answer a few questions that came in during the town hall that are related to students living in housing. So I'm going to read the question exactly as it was posted. Do you think SJSU jumped the gun on deciding to operate housing at full capacity? The current implications are that I have to wear a mask in my own bedroom.
Yeah, I appreciate the question. Do I think we jumped the gun? No. This is pretty dynamic and still changing. And so things may change. I think our response is to really try and understand what are the needs of our students and really try and provide that. And that's really the purpose of housing. And so when we opened that up, we were confident based upon what we had done over the past year that we could offer a safe environment. Our housing team did a great job and our students who were living in the buildings did a great job. And we ended up having a safe environment. So as we sort of go through and things are evolving, as we saw in the beginning of the pandemic, we will not hesitate to make an adjustment if the science and safety warrants it. Right now, we're going to proceed with the kinds of protocols that we have in place. We may have additional protocols that we add. So far, housing has been safe, but we're absolutely looking at the variants and we will make a determination. Whatever wherever the science leads us and wherever safety is going to lead us. So I think we made the decision that we could make at that time. And I think it was the right decision. And we will continue to make the right decisions as we go forward with confidence in our team and confidence in our students.
Great, thank you. And because we have just a few minutes left, I'm just going to ask one of the remaining questions and then remind everyone that we'll carry student questions over to the town hall, which will also be recorded. First, so here's the second question for you, Patrick. For the students staying in the dorms, or residence halls as we like to call them, if they or their roommates test positive anytime during the school year, what are the protocols they will follow on where and how to isolate?
Right. So it really depends on the specifics of them testing positive and the contact tracing that will happen around those students. So anytime we have a student that's tested positive, we move into a quarantine protocol and get them to a quarantine space if that's appropriate, or we'll have them quarantine in the space that they're in. Obviously, with a roommate, that becomes a bit of a complication. We would likely want to, one, get the other roommate tested and do all the contact tracing that is necessary to make sure that both students are safe. And then we would, in all likelihood, move one student to a quarantine location and make sure that they're well and that they have the support that they need to have. We did this again last year. We moved through this process and made sure that students were safe so that when if somebody had been exposed or tested positive, we did this exact same thing. We will do that again this year and make sure that we respond very quickly when we have these kinds of reports. And so we would address it in a way that would ensure the safety of both of the students, as well as any other exposures that we determine as a result of the contact tracing process. And we will, Lisa, so everyone knows, we will talk in explicit fashion about the kinds of housing questions that are coming up. So I don't want people to feel like if you didn't get your question answered, we won't deal with it. We will make sure that we spend a lot of time on housing at our upcoming town hall.
Very good. Thank you so much, Patrick. At this time, I'd like to invite President Papazian back to finish our town hall. And President Papazian, as I sign off, I'll leave you with a question that I think is probably on the minds of several members of our community. Why aren't we moving backwards in the ADAPT plan since cases are surging again? So any thoughts you have and any words of wisdom and support that we can hear from you, I'm sure the community would really appreciate.
Thank you, Lisa. And thanks to all of you for all of your really important questions. Continue to check the website for additional responses to them. To the question about moving backwards, when we actually created the first draft of our ADAPT plan, We realized at that time that this wasn't a linear process. It hasn't been through the past 18 months, and frankly, it won't be going forward, hence adapt. And we will continue to adapt as circumstances require. Very close alignment of our team with the Santa Clara County of Public Health. We're constantly in touch, and I think somebody mentioned policy formally meets once or twice a week, but in fact, many more conversations are happening every day and many times a day to ensure that we're getting that feedback, that we're aligned, and that we're making timely decisions for all of our campus community. I want to also say that we also recognize, if we step back and take the longer view, that we are still in the pandemic, and at some point the pandemic will become endemic, which means we'll be living with this for quite some time. And so we really do have to continually adapt and be ready to do so. I think our campus community has done a remarkable job doing that. And I just want to acknowledge it and appreciate all that you're doing. Continue to provide us the feedback and the input that you have. Continue to raise your questions. Continue to reach out in terms of some of the responses. And we will continue to share and make adjustments. And some of them may be small tweaks, as we did very recently when we moved to first, there was no mask mandate indoors for those who were vaccinated, and now there is. We'll continue to make those adjustments, and some ultimately may be larger adjustments. And if science and health and safety require it, I can assure you we will make those decisions, and we will adapt and we will pivot. So with that, I want to thank you. Again, this is an ongoing, a dynamic situation, and we're all in this together. We'll continue to work together as a broad university community and ultimately take care of each other to ensure that everyone is safe, but that we can support our mission, which is to support the learning of our students. So thank all of you. And as I said, continue to check back on the Health Advisory's website, and we'll continue to try to be as responsive to your questions as possible. Thanks so much for joining us.